right, Paul, are you excited?
Woohoo! Let's do this.
Get excited.
Wow! I am Paul Deger, the Clinical Director at PsychHub, and we are debunking mental health fact or fiction. And I've never seen this before. Who put the... Therapy. We are first going to debunk therapy.
I'm not sure you want to say you want here to debunk therapy.
We're going to educate you folks about therapy. Therapy is just talking about my past. No, it is not. While you may share something about your past, therapy is really about the present moment and getting an understanding of, we go to the CBT and the cognitive triad, how are my thoughts influencing my feelings and my behaviors? So it's really about the present and really future. So that's bunk. It's not about the past. Therapists make people feel better after each session. No. While you're doing the work, it may bring up some stuff. It's not just to feel better because, your hairdresser, your bartender can do that for you. This is about working through new skills so you can manage when life is hard or easy. It's not overall, it's to make your life better, but you may feel sometimes kind of anxious or a little upset, and that's okay because that's kind of like what life is. So that's cool. You're good. Okay, next up. That's a long one. Therapy requires work outside of individual sessions with a provider. Okay, I'm thinking if it's a real long statement, it's probably true. That's what I'm going to go on from here on out because this is completely accurate. Most of the work, most of the change that happens is not in the session. The session is really where you identify what you're going to practice. Because ultimately, good therapy is about practicing new skills and exploring those. So the real work is going on in between the sessions. You still got to go to your sessions to identify what am I going to work on for this week. But good therapy means you're going to do some work in between the sessions, and that's okay. Nothing more than you can do. A good therapist will work with you on, okay, this is a good amount to do this next week. This is a good level of difficulty. My therapist can't fix everything. Well, I do when I work with people, but most therapists, no, just kidding. So it's not about fixing anything, because that means you show up broken. When you show up to therapy, you really have everything you need in that moment. And so it's about the therapist working with you to call out your natural gifts, your talents, your abilities. There's no fixing needed because nobody's broken. We just have some work to do, that's all. Long one, so it means it's probably true. Let's see if that pans out. Whoops. Mental health records have extra privacy protection compared to medical records. Wow, this is, I didn't expect this one. Okay. So HIPAA applies to all medical records. And as far as extra privacy protection, I think that would be a statement that has accuracy to it. That we want to make sure that you're comfortable expressing in sessions and that there's no sense of this is going to get out in the public. So I think we can go with it. Robbie, you want to? Okay, yeah, that we can go with this one, that there is extra protections. Did Amy put that one in? You have to have a talking with her. Okay. My therapist will interrogate, blame, and shame me. That's horrible. Is this a myth that's out there? That's awful. I was gonna say they're your buddy, but actually that's not accurate either. But yeah, don't believe that one. It's, no, they're gonna partner with you or they're gonna work with you, but they're not gonna interrogate, blame, and shame. So, okay. Treatment may take some trial and error to find the right fit. Yeah, totally. Actually, it's really, in the research, even more so than the therapeutic approach, it's really having a good relationship, a trusting, safety relationship with the therapist. It's okay if the first one doesn't work out. And most good therapists will give you a chance to sort of do a trial period, maybe even an initial, short session to just have a conversation, almost like, when you do a job interview, you're kind of checking each other out. So it's okay if the first one doesn't exactly work out. And then you begin to get a sense of what you do need in therapy to have a safe, trusting, reliable relationship. So that one, totally true. Robbie agrees, totally true. Who bought the statement? Asking someone if they're thinking about suicide increases the likelihood that they will hurt themselves. Completely wrong. You're not inducing anything that isn't already there. And you create a safe space so that someone maybe can finally voice and talk about it. Because if you're talking about it, you're taking the first step to doing something towards not only safety, but healing. So no, it's okay to ask someone if you're thinking, oh, I'm not sure if this person's okay. The most compassionate, loving, caring thing you can do is ask them. They really actually probably want you to ask and maybe just are too afraid to bring it up. So that one's completely wrong. Okay, another big one. Catch. Okay. You didn't even try. There is nothing I could talk about with a therapist that I couldn't just talk to a significant other or friend. It's not just talking to someone. It's about someone who has the knowledge and skill to understand what are the barriers to the change, the goals you want to work on. So to say that therapy is just talking about something to someone, which you can talk to anyone, that's not what therapy is. And so this is a really good one, because a lot of people, I'd just rather talk to Joe down the street. But no, therapy is working with a skilled, just like you can't just talk to someone about your, heart disease or about your car not working. You go to a mechanic. You don't talk to your, the person cutting your hair. Well, maybe you do to fix your car. But, okay, going on tangents, but no, not the same thing. Woo, thank you.